As we get older, life changes in so many ways, doesn't it? Our bodies feel different, our energy levels shift, and the things we enjoy or worry about can evolve. Sometimes these changes touch on very personal aspects of our lives, things that might not be easy to talk about, even with close friends or family. It's a quiet reality for many men over 60, navigating these changes and sometimes without realizing it, falling into certain habits or practices that aren't actually the best for our health or comfort in this new phase of life. It can lead to unnecessary discomfort, frustration, or just a nagging feeling that something isn't quite right. This is a topic most people shy away from, a sort of unspoken area, but understanding it is really important for your overall well-being and peace of mind as you age. There are simple things, subtle points of awareness, that can make a significant difference in how you feel, both physically and emotionally. In this video, we're going to gently explore some key considerations for men over 60 regarding a very private matter, focusing on approaches that support your health, comfort, and confidence. We're not talking about anything complex or difficult, just practical, easy-to-understand ideas. Stick around to the very end, because there's something important I want to share that might truly help you feel more comfortable and confident in this area. Let's start by talking about something fundamental that often causes unnecessary worry, and that's simply understanding how our bodies naturally change as we age. It's a fact of life, isn't it? Our hair grays, our joints might creak a little more, and yes, our sexual function and desires also evolve. For men over 60, it's completely normal for things like the speed of arousal to slow down, the intensity of sensation to change, or even for the frequency of interest to decrease. Erections might not be as firm or as reliable as they once were, and achieving orgasm might take longer or feel different. Now, the mistake many men make here isn't in experiencing these changes. That's natural. The mistake is often in how they interpret these changes. They might see them as a failure, a sign of aging poorly, or a loss of masculinity. This interpretation can lead to frustration, anxiety, and sometimes trying to force things to be like they were when they were younger. This leads to the first actual practice that can be less than ideal: ignoring or fighting against the natural changes. When you expect things to be exactly as they were decades ago, you set yourself up for disappointment. This emotional pressure can make the physical experience less enjoyable or even stressful. Instead, embracing the natural pace of your body after 60 is key. It means understanding that slower doesn't mean worse, just different. It means appreciating the sensations that are present, rather than mourning the ones that might have diminished. It's like adjusting your running pace as you get older. You still enjoy the run, but you listen to your body and find a rhythm that works now. Trying to sprint like a 20-year-old when you're 65 is likely to lead to injury. Similarly, expecting your sexual responses to be identical to your younger years can lead to frustration. A healthier approach is acceptance and curiosity, exploring what feels good. Now, this gentle acceptance is the opposite of fighting the changes, and it immediately reduces a huge source of potential psychological strain. It's about renegotiating your relationship with your own body and its evolving capabilities, viewing it with kindness and understanding. Think of it like tending a garden in different seasons. What worked in spring might not work in autumn, but the garden can still be beautiful and fruitful with different care. Your body is the same. It just needs care suited to its current season. Moving on from understanding the pace of change, the second area where men sometimes run into trouble after 60 relates directly to the physical act itself. As tissues age, they can become less elastic, thinner, and sometimes drier. What felt perfectly fine in your younger years, perhaps a certain level of vigor or friction, might now cause irritation, soreness, or even minor skin tears. This brings us to a crucial point: the importance of gentleness and lubrication. Many men, perhaps out of habit or not realizing the change in tissue resilience, continue with the same level of intensity they used decades ago. This can be a silent source of harm, leading to persistent discomfort, inflammation, or making the experience something to dread rather than enjoy. The mistake here is assuming your body's physical vulnerability hasn't changed. It's like using the same rough sandpaper on a delicate antique table that you would use on a sturdy piece of timber. The results are going to be very different, and not in a good way for the antique. The simple, actionable step here is to significantly dial down the physical force and friction. This means using a generous amount of a good quality, body-safe lubricant. Water-based lubricants are usually a safe bet, but it's worth experimenting to find what feels most comfortable. It's not about needing help, it's about smart body care. Think of it as moisturizing your skin to keep it supple and prevent dryness and cracking. It's just good maintenance. The technique itself should become much more about gentle strokes and pressure, focusing on pleasure and sensation rather than speed or intensity. This change in approach is not a compromise. It is an adaptation that allows for continued enjoyment without causing physical stress. It's about being kind to your body. Some men might feel that using lubricant or being gentle is somehow less masculine or less potent, but that couldn't be further from the truth. True strength and confidence come from listening to your body and giving it what it needs to function comfortably and healthily. Ignoring physical discomfort and pushing through can actually create a negative association with the act, leading to avoidance and psychological distance. So, make gentleness and lubrication non-negotiable aspects of your private time. It's a form of self-respect and practical health care. Thirdly, let's consider frequency and its impact. There's no magic number for how often a man should engage in this activity, regardless of age. What's healthy is entirely personal. However, a potential pitfall after 60 can be excessive frequency, perhaps driven by boredom, stress, or trying to prove something to yourself. While it's generally a safe activity, overdoing it can lead to several issues specific to an older body. For instance, very frequent masturbation can potentially lead to persistent irritation or soreness, as the tissues don't get adequate time to recover. It can also become physically draining, impacting overall energy levels. Think of it like exercising. Regular exercise is fantastic for you, but overtraining can lead to fatigue, injury, and burnout. Similarly, engaging in this activity too often without adequate recovery can leave you feeling tired or depleted. Another aspect is the potential disruption of sleep patterns. For some men, engaging in this activity close to bedtime is relaxing and aids sleep. For others, particularly if done with intensity, or if it causes any physical discomfort, it can actually be stimulating or cause enough minor irritation to make falling asleep difficult. The mistake here is not finding a frequency that aligns with your current energy levels and physical recovery capacity. It's treating it as something you must do frequently, rather than something you choose to do when it feels right and beneficial. The actionable advice is to pay attention to how you feel afterwards and the next day. Do you feel relaxed and content or tired and sore? Does it interfere with your sleep? Finding a sustainable rhythm means listening to your body's signals for rest and recovery. It's about quality over quantity. For some, this might mean reducing frequency compared to younger years. For others, it might mean maintaining frequency but adjusting the way it's done, being gentler, using lubricant. The key is to avoid the trap of thinking more is always better. A healthy frequency is one that leaves you feeling positive, refreshed, and comfortable, not drained or irritated. It's about integrating this activity into a balanced lifestyle that supports your overall energy and well-being, rather than letting it become a compulsive habit that detracts from other aspects of life. Finding that balance is a form of self-care, ensuring that this private act remains a source of pleasure and relaxation, not a silent drain on your physical or emotional resources. It's about tuning into your body's natural rhythm, which might have shifted, and respecting that new pace. Now that we've touched on understanding age-related changes, the importance of gentleness and lubrication, and finding a healthy frequency, let's move on to some other areas that men over 60 should be mindful of for their health and comfort. The fourth crucial point, and one that might seem obvious but is sometimes overlooked, is basic hygiene. As we age, our skin can become more sensitive, and our immune systems might not be quite as robust as they once were. This means that maintaining good hygiene practices around private areas becomes even more important. The mistake here is neglecting simple cleaning routines, perhaps out of habit, or just not thinking it's necessary before and after. Poor hygiene can lead to minor infections, skin irritation, itching, or other uncomfortable issues that, while usually not serious, can be persistent and bothersome. Imagine leaving dishes in the sink for days. Eventually, things start to smell, and can become a breeding ground for bacteria. Our bodies are similar. They need regular, gentle cleaning to stay healthy. The actionable advice is straightforward. Wash the area gently with mild soap and warm water before and preferably after engaging in the activity. Ensure you dry the area thoroughly but gently to prevent moisture buildup, which can encourage fungal growth. For uncircumcised men, this includes gently retracting the foreskin to clean underneath. It's simple, but consistently practicing good hygiene is a powerful preventative measure against irritation and minor infections that can cause significant discomfort and make the experience unpleasant. It's not about being overly sterile, but about routine cleanliness as part of overall body care. This is particularly important if you are using lubricants or other products. Think of it like brushing your teeth, a basic essential part of maintaining health that prevents bigger problems down the line. Neglecting this can lead to persistent issues that, while not life-threatening, significantly diminish quality of life and comfort. Making this a non-negotiable step in your routine ensures that your private moments remain clean, comfortable, and healthy. The fifth point is about perhaps the most important skill for navigating any aspect of health as you age: listening to your body. Our bodies are constantly sending us signals, sensations of comfort, discomfort, pleasure, pain, fatigue, or energy. The mistake many men make, particularly in this private area, is ignoring signals of discomfort or pain. Perhaps they push through because they are focused on achieving a certain outcome, or they dismiss minor aches as just getting old. However, persistent discomfort, burning, itching, or actual pain during or after the activity are not normal parts of aging and should not be ignored. Pushing through pain can lead to exacerbating minor issues, turning them into chronic problems. It's like hearing a strange noise in your car engine but turning up the radio to drown it out instead of checking under the hood. Eventually, that small noise could become a major, expensive problem. Your body's signals are its way of telling you something isn't quite right. The actionable advice is to become more mindful and attentive to the physical sensations you experience. If something feels uncomfortable or painful, stop. Pay attention to where the discomfort is and when it occurs. Is it during a specific motion? After a certain amount of time? Does it linger? Ignoring these signals is a silent form of harm, as it prevents you from identifying potential issues early on. This self-awareness allows you to modify your approach, use more lubrication, change technique, or recognize when something might need professional attention. Listening to your body is a form of self-respect and essential for preventing minor irritations from becoming significant health concerns. It's about being present in the experience and prioritizing your comfort and well-being over any perceived goal or expectation. This practice extends beyond this specific activity. Cultivating body awareness is beneficial for overall health, helping you notice changes and address them proactively. So, tune into those signals, treat them with respect, and let your body guide you towards what feels comfortable and healthy. Sixthly, let's delve into the psychological and emotional landscape surrounding this topic after 60. For many men, this activity can be tied up with feelings of identity, self-worth, and even a way to cope with stress, loneliness, or changes in their lives like retirement, loss of a partner, or health challenges. While using it as a stress reliever or a source of comfort is perfectly understandable and can be healthy, the mistake occurs when it becomes the primary or only coping mechanism for deeper emotional needs like loneliness, anxiety, or boredom. If it's consistently used to numb difficult feelings rather than address them, it can lead to a feeling of emptiness or dependency and prevent you from seeking out more fulfilling ways to connect with others or engage with life. It can become a solitary activity that isolates you further if it replaces efforts to build social connections or pursue hobbies that bring genuine joy. Imagine using a painkiller for a broken leg without ever setting the bone. It might numb the pain temporarily, but the underlying issue remains and won't heal properly. Similarly, using this activity solely to cope with loneliness won't build meaningful connections. The actionable step here is to gently examine the role this activity plays in your emotional life. Are you turning to it primarily when you feel stressed, lonely, or down? Does it prevent you from engaging in other activities that might address those needs more effectively, like calling a friend, joining a club, or going for a walk? This isn't about judgment. It's about honest self-reflection. If you notice it's becoming your main coping strategy, consider exploring other avenues for emotional well-being. This might involve actively seeking out social interactions, finding new hobbies, practicing mindfulness or meditation, or even talking to a therapist about coping strategies for loneliness or stress. Integrating this activity into a balanced emotional life, where it's one source of comfort among many, is much healthier than relying on it exclusively to manage difficult feelings. It's about ensuring it contributes positively to your overall emotional health, rather than becoming a substitute for addressing deeper needs. Finally, and perhaps most importantly, the seventh point is knowing when to seek professional advice. There's a common tendency, particularly among older generations of men, to tough things out and avoid talking about health issues, especially those related to sexual health or private matters. The mistake here is delaying or avoiding a conversation with a doctor when there are clear signals that something might be medically wrong. Symptoms like persistent pain, significant or sudden changes in function that aren't just gradual age-related shifts, unusual discharge, sores, lumps, or any worrying physical changes should not be ignored. These could be indicators of underlying medical conditions that require diagnosis and treatment. Waiting too long can allow treatable conditions to worsen. It's like noticing the check engine light on your car dashboard, but deciding to just keep driving and hope it goes away. That light is telling you to get things checked before a minor issue becomes a major breakdown. Your body's signals are similar. The actionable advice is clear. If you experience any persistent or worrying symptoms related to your urological or sexual health, make an appointment to talk to your doctor. It can feel awkward or embarrassing to discuss these topics, but doctors are medical professionals who have heard it all before and are there to help you maintain your health. They can assess whether your symptoms are related to normal aging or if there's an underlying condition that needs attention. They can also offer advice on managing age-related changes, discuss issues like erectile dysfunction, or provide guidance tailored to your specific health profile and any medications you might be taking. Remember, your doctor is your partner in health. Being open and honest about any concerns, no matter how private they seem, is crucial for getting the right care and maintaining your quality of life. Don't let embarrassment prevent you from seeking help when you need it. Addressing potential health issues early is always the best approach for peace of mind and physical well-being. So, we've covered quite a few points, haven't we? Thinking about being kind to your body as it changes with age, paying attention to using gentleness and lubrication, finding a healthy rhythm that supports your energy, making sure to keep things clean and comfortable, listening carefully to what your body is telling you, reflecting on how this activity fits into your emotional life and ensuring it's not your only way of coping, and knowing that your doctor is there to help if you have any concerns. It might seem like a lot to consider for something that's meant to be a simple private act, but really, it all boils down to self-care and self-respect. It's about acknowledging that your body has changed and adapting your approach to meet its current needs. There's no need for frustration or worry about things being different than they were in your younger years. Different doesn't mean worse, it just means different. Finding comfort and pleasure is absolutely achievable at any age, but it often requires a little wisdom and a willingness to adjust. Remember, small changes in how you approach this private aspect of your life can make a really big difference to your physical comfort, your peace of mind, and your overall well-being. It's about integrating this part of your life into your overall health plan, just like you would think about diet, exercise, or getting enough sleep. When you approach it with kindness, awareness, and realistic expectations, it remains a healthy, positive, and comforting part of your life. There's power in understanding your changing body and adapting your practices accordingly. It frees you from outdated expectations and allows you to enjoy what feels good and right for you now. It's a quiet form of self-empowerment. You're not alone in navigating these changes, and there's nothing to be embarrassed about. Prioritizing your comfort and health in this area is just as important as managing blood pressure or keeping active. It contributes to your happiness and your sense of vitality. Have you found certain approaches or awareness points have helped you personally as you've gotten older? Sharing your experience, if you're comfortable, can be incredibly helpful for others who might be watching and feeling unsure or alone in dealing with these changes. Please feel free to share your thoughts or any tips you might have in the comments below. It creates a valuable space for connection and shared wisdom. If you found this video helpful, if it gave you something to think about or offered a little reassurance, please give it a thumbs up. It helps this important information reach more men who could benefit from hearing it. And if you haven't already, consider subscribing to my channel. I share regular videos focused on practical, positive ways to live well, stay healthy, and thrive at every age. Don't miss out on future tips and insights that can support you in living your best life. Thank you for watching and for spending this time focusing on your well-being. Taking care of yourself in all aspects, physical, emotional, and yes, even private, allows you to truly live your best life, vibrantly and comfortably, no matter your age. Remember, aging is a journey, and understanding and adapting to its changes is key to enjoying the ride. Live your best life at every age.